Now, as the country continues to grapple with the ravaging force of the COVID-19 pandemic, the safety of frontline workers has also come to the fore. Speaking on PM Express with Evan Spencer, Greater Accra Divisional Secretary of the Ghana Medical Association, Dr. Winfred Baah, said inadequate availability of personal protective equipment poses real threat to frontline workers.
For now, I think gloves and face masks are available.
Okay.
But like I said, it's about the numbers.
Okay.
And we are expecting that the numbers will be increasing.
Yeah.
So we'll be needing more people in the front line.
Yeah.
So there will be increased demand for these face masks and all of that. So we can't say it's enough now.
Yeah.
For now, what we have to work, yes, is there. But we can't say it's enough. And we should know that there's a global shortage
of it. Everybody else is looking for it.
Everybody else is looking for it.
In fact, not only healthcare professionals, ordinary people are looking for it.
Yes.
You're competing now with all of us. I have a box of gloves in my home with face masks, etc.
Exactly.
So that means one box short for you who need it.
Exactly.
In the
and that's why we have to get in now, or the authorities have to get in and make sure that it's available for healthcare. For example, in Italy, what they are doing now, they are calling on, this some industrial workers also use it. Now they are saying, don't request for it again. We want to make them available for health workers. There must be some policy directions in that line to make sure they are available. Because you see, like we said, if like Italy right now, the doctors are overwhelmed. When the doctors are overwhelmed, what happens is that sometimes some of them work like 12 hours, 24 hours continuous.
Yeah, I heard a story on BBC. Yeah. One of the doctors says you can't even take a toilet break.
No, because the patients are just coming in.
Yeah.
And when you do that, they get fatigued. When you get fatigued, you start making mistakes. Yeah. When you start making mistakes, that's when you can easily
in the face of this virus.
Yes.
You can't afford to make
mistakes. You can't afford to make a mistake.
You put yourself and the patient
at risk. At risk.
The president announced over the weekend when he did the address that they've ordered more, but you are with the biggest health facility. Do you have enough?
I don't think so. I don't think we have enough, at least from what I have seen and from what others say. We are told that some have been ordered. Today I read the news that the Pentecost Church has donated some to the ministry. So we are hoping that a lot more is coming. But for now, when you ask, they will tell you what we have is not enough, so we have to use it judiciously.
When they say judiciously, what do they mean?
So it's like when it's really needed, then we use it. But you see, those ones can also compromise health workers in a way, So we need to get enough. Other countries are pushing to manufacture it themselves. This is the time when our companies, our businessmen can take advantage and see Aprotech, see what we can do. People are using plastic rubber, and they are making things out of them.
In Italy, they're being so terrible. Yeah. They're using garbage bags, really, to design.
I think our industries can look at how they can help. Now, I've heard of some of the universities producing the hand sanitizers and things. These are very good things to do. We have to wake up to the challenge. This fight is for everybody.
Yeah.
We are the frontliners, but everybody must be part of this fight.
So interesting. So for the doctors, you say you're not enough protection with the PPEs to go into this fight.
Yes.
Well, Dr. Baah also says the health personnel need requisite training on the use of the PPEs. Even though he could not put figures to it, Dr. Baah said some medical personnel have been quarantined or under self-isolation because of exposure to infected persons.
To protect frontline health workers, we need to do more training and education. There are some of the health workers who do not even know how to don the full PPE because we are not used to it. We didn't have such things around. And so today like this in Colombia, we did training for some of the health workers. And people were more confident now to face it.
Okay.
But it's like, okay, if I can wear it, then I'll be able to face it better. So it increases people's confidence. Knowledge is power. So we need to do more training on how to wear the PPE, how to do all of that.
PPE once worn cannot be reused.
Yes, but now you know, because of the situation, we have to reuse some of them.
But what that means is that it has to be properly disinfected once removed.
Exactly.
And there's a whole protocol for removing a PPE.
For removing the PPE. There's a whole protocol.
Are doctors equipped to do that?
Exactly. So that's the training that has to go on. And I must say that it has started.
Okay.
Started? Yes.
Gee.
It has started, but it has to go on. We need to do more training, yes. More training on that. How to wear, how to remove it so that you don't get infected. Because you can wear it very well. After doing the procedure, if you don't remove it well, you can contaminate yourself.
It will be absolutely useless.
Exactly.
Having worn it.
Yes. And then when healthcare workers are on the front line, they get exposed. They have to be isolated or quarantined. Now, when that happens, we usually have a few people who want to be in their homes. That is if you live alone. If you have a family, it's either they move out.
You mean for health workers?
Yes, for health workers. So what we are
Has there been a case where health workers have been quarantined?
Yes. Most of those who have come in contact with the cases at Konfanoche and everywhere, what we do is that once you come into contact with somebody who tests positive, then you because of the contact, you have to be quarantined.
How many health workers are in quarantine or doctors are in quarantine now?
I can't tell you the number, but I can tell you there are doctors, nurses, lab people, and everybody in quarantine now. Some of them are doing something in their homes, some of them at the centers. But the thing is, we want government to get a place for us, because not everybody will get a single room to be in. And so they should get a place for the health workers.
Well, the coronavirus has already infected nearly 400,000 people and killed more than 17,000 globally. Here in Ghana, dozens of people have already been infected, with 2 deaths recorded. Experts say the situation may worsen before it gets better. But it appears the good old anti-malaria drug chloroquine may hold some solutions. The United States government on Tuesday approved the administration of the drug to coronavirus patients. In the following report, my colleague Fifi Kumsin explores the search for a coronavirus cure the world has been desperate for.